Good day, ladies and gentlemen, and welcome to today's webinar, A Cornerstone of the Foster Care System, Foster Families, brought to you by NCSO. It is now my pleasure to turn the floor over to Gerard Brown. Sir, the floor is yours.
Good afternoon, everyone, and thank you for joining us today for this important webinar. My name is Gerard, and I'm a research analyst with the Child Welfare Team at the National Conference of State Legislators. On behalf of NCSL, I would like to welcome all of you to today's webinar titled, A Cornerstone of the Foster Care System, Foster Families. In addition to your wonderful presenters today, I am joined by my colleagues Nina Williams-Mbang and Kyle Ramirez-Fry. For those of you who don't know, the National Conference of State Legislators is a bipartisan organization that serves the legislators and legislative staff from all states, commonwealths, and territories. It develops research, technical assistance, and opportunities for policymakers to exchange ideas on the most pressing state issues. Today's webinar is a platform for information exchange. We are aiming to make our 60 minutes together as interactive as possible. Feel free to type your questions at any point in the Q&A box, which you'll see on the bottom left-hand side of the screen, and specify which speaker you're addressing your question to. To begin building some comfortability with the chat function, and to also learn who is on the line today, I invite you to type in the state from which you are calling now. Cool. All right. I want to briefly mention the resources at the top right of your screen. You'll see an icon that looks like a square piece of paper with a play button on it. As you mouse over this icon, you will see the words, Show Me the Media Library. If you click on this icon, you will be able to access a PDF of the slide deck and other relevant handouts. For access to all URLs within the presentation, I welcome you to access and download the PDF where you can easily then visit the links we've included. This webinar is being recorded and will be available at NCSL's website by next week as a video archive. Today's webinar is the first of two webinars that are part of NCSL's Child Welfare Fellows Program. Because foster families are a topic of interest to many, we've opened registration to a wider audience, including others that are not part of the Child Welfare Fellows Program. However, since this webinar is part of the Child Welfare Fellows Program, we will prioritize and ask questions coming from our fellows first. On your screen, you can learn a bit about NCSL's Child Welfare Fellows Program, which began this year. Our first class is composed of 22 members, including 3 legislative staff and representing 17 different states. Participants are selected through a rigorous application process. Many were able to participate in the kickoff meeting this July and will participate in our final meeting in November and a webinar in January. Interested in learning more? I invite you to visit our website. Today we're going to hear from a national expert about the Children Need Amazing Parents program, or the CHAMPS program, and the Quality Parenting Initiative. Together, these two programs focus on understanding and creating stable placements for children and youth within the foster care system, as well as ways legislators can approach reform to create more stable placements. You will also hear from an Oklahoma legislator and a former foster parent and mentor about her efforts to improve the foster care system within her state. We are pleased to have with us today Jennifer Rodriguez. She is currently Executive Director at the Youth Law Center, and prior to joining the YLC, she spent 8 years leading community organizing and legislative advocacy efforts with other foster youth in the California Youth Connection. Jennifer spent many years of her childhood in foster care and juvenile justice facilities, and has spent most of her life advocating to ensure justice, compassion, and opportunity for system-involved youth. She is also co-director of the National CHAMPS campaign. Senator A.J. Griffin is from the great state of Oklahoma, where she chairs the Senate Appropriations Subcommittee on Human Services and is a member of the Health and Human Services Committee. Senator Griffin is a decorated legislator. Her accolades include being the 2014 Terry Hyman Child Advocate of the Year, a 2014 CASA Making the Difference Award recipient, a 2017 Champion for Children, and much more. She herself is a foster parent, making this issue very near and dear to her heart. All right, and without further ado, we will now hear from Jennifer from the Youth Law Center. Jennifer, the floor is yours.
Thank you so much. Good afternoon, everyone, and thank you so much for joining this webcast today and for being really interested and committed to the goal of improving the lives of children in foster care across the country. So you heard I'm the Executive Director of the Youth Law Center. We are a national advocacy organization focused on ensuring that children in the foster care and juvenile justice systems across the country can thrive. And I am thrilled to serve in the role of co-chair for this very exciting new national campaign called the Children Need Amazing Parents campaign that is really focused on building a new policy agenda across the country that will support what we believe is the most important and fundamental intervention for young people in foster care, which is ensuring that they have excellent parenting every day. So I want to start off by telling you just a little bit about the CHAMPS campaign and who we are and what our end goal is. So we are a coalition of partners from across the country, researchers, advocates, pediatricians, faith-based communities, foster parents, youth, and legal services providers, basically every stakeholder in the system who is coming together to say we actually can't achieve any of the outcomes that are typically the focus of discussion in child welfare reform unless we deal with what we know from research, what we know from hearing directly from young people, what we know from the field is the most critical thing, and that's that they are in loving, stable, nurturing homes and receiving the caregiving that's developmentally and biologically necessary for them to both heal from trauma and also be able to take advantage of opportunities in the future. So to that end, we know that parenting is not typically the subject of reform and of policy, and when it is, the conversation is often about numbers. How many beds in our system do we have? How many families do we have? What is the number of families? Or it's about rates. How much do we pay our families? It is rarely about how do we really build a system that has policies that are supportive and enhance and, frankly, don't undermine children getting loving parenting. So the goal of this campaign is to bring all of these very diverse stakeholders together to develop some policy tools to really move the needle at both a state level and a national level on a supportive policy agenda. And we are obviously, as I said before, totally research informed, and part of our goal is helping folks to understand how parenting can't be an afterthought, that in fact we now have decades of research that tells us it's both fundamental and impossible to do any of the other reform for children in care. So I want to talk a little bit about some of the underlying principles of CHAMPS that all of our coalition partners have embraced. And the first is that children, all of them, they need and do best in families. And when I say all of them, this is really a definitive statement. I know that the policy conversation is often which young people are appropriate for families. Our fundamental belief is that every single child needs and actually depends on family as the healing and therapeutic intervention. And that when we put a child in foster care, when we remove them and take them away, our number one assurance and promise to that child and to their community has to be that we are not just placing them in a bed, but that we are going to ensure that they receive loving parenting, whether they're in foster care for 1 hour, 1 day, 1 year, or even longer. I mentioned this earlier, but the research is very, very clear, and those of you who have had the pleasure of talking to young people who have spent any time at all in the system know they will echo this, that having a loving and stable foster parent who can dream for you, that is really the primary intervention for ensuring both safety and well-being for children in foster care. Too often we talk about safety of children in care as isolated and separate from the feeling of being emotionally safe and cared for and nurtured. And all of the research tells us nothing could be further from the truth, that in fact when children are most fundamentally unsafe is when they feel unloved, unnurtured, and like nobody cares for them. And our communities are also the least safe when children feel that way. The third underlying principle of CHAMPS is that our foster parents, our resource families, that they are really relationship builders, that we have for so long thought about them sort of like glorified boarding care homes, that the primary thing they offer is our children a place to sleep at night, where while the rest of the professionals in the child welfare system go around and do the interventions necessary or do the case management or the legal advocacy. But in fact, we know that foster parents do so much more. That in fact, when foster parents are providing excellent care, they're also assisting towards reunification and case plan by providing mentorship to birth parents, nurturing the child's relationship with their biological family, their extended family, their siblings. And this is really important because contrary to sort of the public narrative, we know that more than half of children who enter foster care don't exit to adoption, but actually return back home to their families. So we really have to be thinking about a different role for our foster parents in building up those relationships and strengthening families. And with the implementation of the Families First Prevention Services Act, this conversation is even more timely about how we can really re-envision our foster parents in working with families in the community to both prevent removal and assist with reunification and prevent reentries in an entirely different way than what we've thought about in the past. The fourth principle here is that establishing and prioritizing effective approaches to recruiting, retaining, and supporting foster parents, that they both yield better outcomes and they're also cost effective, that at the end of the day, they are saving systems a lot of resources. And you're a policy audience, so I'll emphasize the cost-effective part, but I often think we cannot quantify actually the costs of some of the impact around not doing this for young people. So when you hear about some of the outcomes that our young people typically experience when they are not supported, when they do not have families, when they feel lonely and isolated in community, and you hear about justice involvement or homelessness, about them losing their own children to the child welfare system and that cycle returning, I'm often struck around how inadequate we are around being able to communicate what the true cost of that. But just in pure dollars, this is cost effective. And then lastly, our principle is that we know that parenting has often been overlooked as a solution to achieving better results. And in fact, many of the solutions have almost been built around a core assumption that it is just going to be too hard to build a system where we can depend on or rely on excellent parents to do things. So we've put a lot of safeguards and resource the system to do things that we would otherwise expect that parents do. Educational advocacy, preparing young people for adulthood, thinking about support to families. We almost have made an assumption that foster parents are not the solution and that we can't build in the supports that would allow them to be so. So in each one of your states, I am sure that you have read headlines about the shortage of foster parents and about what the impact is if children do not have families to grow up in. And oftentimes these headlines are sort of hysterical and fear-inducing and quite frankly often leave both you in your positions and the public with a feeling that the problem is just too big to take on and that can't be fixed, which really has a mixed impact both of, one, raising attention and awareness and urgency around the issues in foster care, but I think also often undermining our own attempts to really build a sense that investment is both effective and can have an impact in the child welfare system. And oftentimes in sort of the rush to simplify what the issue really is around the need to have families to care for our children and to help them heal and to respond to crises like the opioid epidemic or domestic violence or immigration and deportation impacts, the message gets simplified down to we don't have enough beds, as I mentioned earlier. But our research really doesn't support really a lack of beds as being the primary issue or the primary barrier for every single child having a loving and excellent home to live in while they are in foster care. So the most recent research, which was a 2017 Harris poll that asked Americans whether they would consider being a foster parent or if they have already considered being a foster parent, showed that nearly 36% of all adults in the United States between the ages of 18 and 65 would in fact be interested in considering being a foster parent, which is really significant because even if a percentage of that number signed up to be a foster parent, we would have no lack of a family for every child. We would have all of our capacity need met. What the data actually really shows us is that our issue is much more a retention issue. How do our systems both support our families once they come in, and by support, some of the discussion is around financial support, but much more of the discussion is how do they provide adequate customer service and really treat families like they are the primary intervention, really ensure that they are respected and equal partners, that they have a seat at the decision-making table, that we are not making it harder for them to be excellent parents than it is for them to be mediocre parents or, at worst, bad parents. And how do our systems make sure that parents can do all of the things that they need to do, that they have the information necessary to ensure that children have their medical care, that we make it easy for them to sign children up for extracurricular activities and take them across state lines or county lines, that we make it easy for them to include children as full members of their family and travel with them. So frequently, this is what we hear from families are really the barriers. They are not exiting because caring for children is too difficult or the needs are too great. They are exiting because working with the system is simply too difficult, which on one hand is discouraging, but on the other hand is encouraging because this is a problem that we can fix. We can fix it with a policy approach, we can fix it with a practice approach, we can fix it with a culture approach that really reorients the whole system around recognizing excellent parenting as the most important intervention. So just to reemphasize, we know that high-quality foster parenting, it results in stable placement, it saves money, it improves child outcomes. And if you talk to any young person who has been in foster care about what made a difference, resoundingly, they may mention some programs that states have made investments in. You might hear mention of, an excellent education program or a particular transitional housing program or a great lawyer or a great social worker. But so often, if you listen, what you will really hear is for those young people who have gone on to feel happy and feel successful as they transition from foster care, it has really been because of the relationship with somebody who cared enough about them to go above and beyond their professional role and to parent them in some way, shape, or form. So we know that making sure that young people are in stable families, and I think one of the things is language, and so we think about the families as placements. I think we have to move towards really thinking about the family as the intervention. We know that that results in safer children, so less unsafe parent-child conflicts, prevents children from making decisions where they place themselves in harm's way or actively harm themselves. We know that also high-quality parenting increases stability and chances of permanency later on and more timely permanency. And when I say permanency, I mean that in the broadest sense. So reunification, adoption, guardianship movement to a relative who's willing to become forever family. And that maybe most importantly, that ensuring that children are in high-quality parenting really is the most important intervention we can provide for children's well-being. That we know that when children are moving from home to home, that instability is associated with difficulties in attachment, increased stress-related responses that literally alter children's regulatory systems, their entire biology, including their brain chemistry, and that instability also exacerbates the external problems that we can see, behavioral problems, increases use of congregate care, that we see the impacts in instability as young people enter the delinquency system or end up using substance abuses, all of the negative outcomes that are so typically associated with the experience of being in foster care can almost all be traced back to whether or not we've ensured that young people have stability and relationship. So the fiscal impact. So in addition to all of the costs that go with our children's lives, there's also costs in the bank account as well. We know that reducing foster care instability literally saves money, that children have shorter lengths of stay in care as families are able to actually support birth families and work actively towards reunification, that this increases in visits and families being able to have the support they need to get their life together, get their child out. We also know that better child outcomes means less use of very expensive and costly mental health services, dependency on public services, and increased tax revenue as our young people go out and live the lives that they were meant to live. And that there's the less agency administrative costs that are associated with all of placement disruptions and the cost of finding a new placement and recruiting more families and needing to put in really costly crisis interventions. We also know that retention of foster parents saves money, that it results in lower costs for foster parent recruitment and training if we are simply able to keep the excellent parents we have and treat them really well. And we have more seasoned foster parents that are willing and able to care for children, particularly children who have greater challenges as our states across the country move towards moving children out of congregate care and into families. And that opportunities to promote foster parent retention, despite the way that people talk about sort of big new recruitment and retention campaigns and the cost, that they're often really inexpensive. I already mentioned customer service, but a lot of the other policy options have low or no cost, and I'll give you some specifics in just a couple minutes. But we know even when there is minimal cost, there is very high return on investment, especially if they're targeted at particular foster parents and those parents within their first year of fostering when we know we lose so many. So the CHAMPS campaign is focusing on 6 primary policy areas, and there are obviously more, but these are the 6 that we really prioritize as a starting place for states who are interested in tackling this issue immediately and really figuring out how to build a policy framework in your state that is supportive of children getting excellent parenting. So the first element is ensuring that our policies support relationships between birth and foster families. In too many places, while we have some consensus that this is a really important role of excellent foster parents in our system, given how many children reunify, given the need for families to have supports, we see policies that are actually literally getting in the way. So everything from a lack of ability to share information about birth parents with the foster parents who are caring for the children, to a lack of policies that encourage meetings between birth and foster parents, to visitation policies that really both separate out and almost make foster parents and birth parents adversarial. And in some places, some jurisdictions, even the way our concurrent planning policies have actually been implemented through the courts and through policy also make it hard to encourage this kind of relationship and teamwork and co-parenting between the two most important people or parties in the child's life. The second big policy area is implementing data-driven recruitment and retention practices. So often our recruitment and retention is sort of driven by throwing the cutest graphic that we can see on a piece of paper and the most catchy little phrase that often undermines the first goal. It might say, open your heart and your home to a child who has no family, even when you know the expectation is actually that they're going to work actively towards reunification and be mentoring and coaching a birth parent. But what we really want systems to do is to start looking at their data to figure out what families do we currently have, who specifically are they signed up to be taking, when do families exit our system, where do we have the greatest need, do we have the greatest need to recruit families for 6 to 8-year-old African American boys in sibling sets of 3 in this jurisdiction in our county, in our parish, in our state, then that's where we should be focusing our recruitment efforts. Where are we losing our foster parents? Is it on the 3rd session of training? Is it during the licensing or approval process? Is it after the first complaint investigation? We have to start getting really exact and precise about what the barriers and the challenges are if we're going to develop policy solutions that are actually responsive and effective. The third big policy priority is that we engage foster parents in decision making. So if our families are in fact the most important intervention, we have to be sure that policy supports their participation in case planning processes, in court participation, in child and family team meetings or multidisciplinary team meetings, that there cannot be policy barriers, and in fact there should be policy encouragement for our families who know the child better than any other stakeholder in the child welfare system to be an active and central part of that process. The fourth big policy priority area is making sure that there is timely access to trusted, dedicated staff and peer support for foster parents. So currently the way we have our training and support structured oftentimes is one really general classroom-based training that is not specific or individualized to the need of a specific child. It is not just in time. It is often not even offered by somebody who has walked in that foster parent's shoes before. And so we have across the country mentoring programs and coaching programs that use experienced and excellent foster parents in an entirely different role to provide really individualized, for anybody who used to watch it, sort of ultra super nanny coaching for our families. And that is not crisis oriented, that you don't just get the support and services and interventions as a parent when everything falls apart, that you get them when all parents need them, which is every step along the way. Fifth, that we are prioritizing placements with family members and with kin. Part of the challenge, I think, of recruitment of strangers is that we are missing a huge opportunity. Most of our children, and particularly our teens who have been on the earth for many more years than a baby, for example, is they already have a network of people in their lives, of friends who have parents, of aunties and cousins and grandmothers and neighbors and coaches and pastors, all of whom might be willing to step up and at minimum have a relationship, but also take that child in if we did a better job around both finding them initially and then really supporting them in being able to take on the role of caring for them. So ensuring that we're doing all of that work as early as possible and that we're really prioritizing the supports necessary for family to be able to care for their children. And in particular, one area that's often really neglected is we have so many siblings, young people who have grown up in foster care who are now adults who are starting to care for their siblings who have very, very little support in navigating the system. And then our final area here is ensuring that children have timely access to physical and mental health services so that our policies are really supporting ensuring that children get appropriate and timely assessments, that they get medical care when needed, that they're able to keep medical homes, that families have the information needed to be able to understand their child's medical history, to know when to seek help, and to really be the partners in implementing any medical or mental health interventions that are necessary in the home, like all parents need to. I'm not going to go through these in a lot of detail because of time, but I do want to emphasize that we have a number of jurisdictions across the country, both local and state, who are showing us and sort of guiding the way towards ways that we could bolster our policies and change our policies to do a better job. So both California and Florida's Quality Parenting Initiative Partnership Agreement, which has been formalized in policy. In Florida, it's now part of statute. In California, it's administrative policy that sets out clear expectations for our families, including their role in supporting birth and foster families, and even more important, clear expectations for the agency in how to support that and make that happen. North Carolina's shared parenting policy, Louisiana and Minnesota's QPI comfort calls, where there is an effort made immediately at the time a child is placed in a home to make a call to the birth parent to introduce the birth and foster parent in hopes of being able to encourage a smooth and consistent relationship. Nevada, Texas, and Wisconsin, who have all changed their visitation to incorporate QPI fostering relationships, where foster parents are actually being trained to coach birth parents in visitation, and the role of visitation is changing to really be around parenting time with the birth and foster parent there together, parenting the child. On data-driven recruitment and retention practices, both North Carolina and Oklahoma are really leaders and examples in showing us how to use data to make a very informed and effective and specific recruitment and retention plan. Engaging foster parents in decision-making. We have an Illinois Foster Parent Advisory Board that actually reviews everything, system improvement plans, policies that the state is going to pass that impact foster parents and sign off, amend before they go forward. California County Transition Planning, having foster parents anytime a child is going to move from their home be a part of a mandatory meeting and really play a central role in planning that transition. Timely access to peer mentors and coaches, wonderful examples in Illinois and Louisiana of foster parent mentoring programs that are providing an incredible amount of resources and have been able to facilitate all kinds of community relationships like utility discount programs, meal trains that for 3 weeks after a child is reunified or placed in a home, Cuyahoga County's dedicated foster parent workers, Tennessee and Connecticut's firewall around prioritizing placements with family members. Whenever a child is placed with a non-family member, having a high-level agency review that ensures that all diligent family finding was done and that workers have really explored every option. So sort of saying when we don't do this and place with somebody that the child is already connected to and already knows, that we better have an agency sign off to ensure that we've done everything possible. And then on timely access to physical and mental health services, the Texas 3 and 30, ensuring that children have 3 very important assessments and medical exams within a certain time frame, and clearly mandating who is responsible for ensuring those happen has been really effective. So many of these examples, as you can hear, come from the jurisdictions around the country that are participating in the Youth Law Center's Quality Parenting Initiative. I won't talk a ton about that, but just so you know, this is really a system change initiative by the Youth Law Center in about close to 80 jurisdictions in 10 states across the country, trying to realign policy, practice, and culture around this goal of supporting excellent parenting. And the key, I think, to the Quality Parenting Initiative is being able to clearly define what our expectations of resource families and then aligning policy and practice with what those expectations are. And some of the big issues you hear reflected in those recommendations, but I want to say when people think about foster parent recruitment and retention, they often are not thinking about things like information sharing, about normalcy and prudent parenting, about ensuring that we have a placement process that gives parents and young people the chance to get to know each other before placement, about court participation, about the way we handle investigations. But what we do hear is that these are really critical for our families. I'm not going to talk about foster care trends, but the data is here for you if you are interested in taking a look at it. What I do want to emphasize is that excellent parenting is just as important for babies as it is for older young people or older youth in our system, and that we have all of the data to support that being true. That, in fact, we know that the single most important intervention for our babies and toddlers, even though we often talk about high-quality child care or early developmental screenings or delays, is are they able to form a healthy attachment? And attachments can be transferred. And if we don't actually help them form a healthy attachment during this really important time of rapid development, that everything about their development ends up being negatively affected. The same is really true for our teenagers. We often think that teenagers don't need families. We actually know now that this period of growth in terms of child and adolescent development is equally important to the early childhood years, and that adolescent brains are literally capable of being rewired and healing from early trauma if we simply provide them the opportunity to have loving and supportive and nurturing relationships through parenting. Some of the ways that the CHAMPS campaign can help you all. We do have a policy playbook that has examples. We can provide policy workshops in your states. We can provide you briefs on specific topics that you might be interested in, training for policymakers in your states. We can also provide one-on-one individual technical assistance as you work on evaluating your jurisdiction's policies and trying to draft new ones. We can provide examples for you, connections to experts, to other jurisdictions who have tried also to do similar work. We do have this CHAMPS pledge that we would urge you to sign on and have all of your colleagues sign on as well. You can read this later, and I'll show you the website in just a second where you can go to sign on. This has a list of who our partners are. Here is our website, and here you can see we have a Facebook page and a Twitter account. Please like us, follow us, keep us informed of what you are doing, the challenges that you are having, and let us know how we can really be partners in this effort to prioritize excellent parenting.
Okay, thank you, Jennifer. Very informative. Next up, we have Senator A.J. Griffin, who is going to share some thoughts related to foster care in her state, Oklahoma. Senator Griffin, the floor is yours. Senator Griffin, are you on mute?
There we go. Now can you hear me?
Yes, we can.
Okay, great. I apologize for that. Thank you, Gerard. Thank you. Jennifer's done a great job of going through a litany of policy opportunities for improvements for states. The policy playbook is a great place to start, and it's important for all policy makers to remember that in this area of work you are never finished until every child in your state is growing up in a loving home with skilled parenting. You're never going to be finished. So although it can sometimes be tiring, just stay with it. I'm going to run through just some quick examples of ways in Oklahoma we've employed many of the policy recommendations from the playbook. Starting with an identification in our state for a need to grow our census of available homes for children to allow for better matches. The desire there is to decrease the disruptive changes in placement for children and to streamline the process so that kids can, on the first try, be placed with a family, be it kinship or a traditional foster home, that meets their needs and is prepared to care for them. One of the ways that we've done that is to be very systematic about the employment of the faith community. And if you Google anything after this presentation, Google Oklahoma 111. That is the way in Oklahoma we have chosen to engage our churches. 111 stands for one church, one family, and one child. And the goal is if we employ a foster family from every church in our state, we can make a huge step forward in meeting the needs of the census of appropriate foster families needed all across the state. And it also just expands the opportunity for those who are desiring to foster to have a built-in network of support through their faith community. So the 111 project is something I want to highlight. The other major step forward was the employment of private partners in the recruitment, training, and retention of potential foster families. The state agency, although they tried very hard, just simply did not meet the need when they were the only group working on that. So the employment of our private partners, we started with a network of youth serving agencies that have already existed, were statewide, and had been working in the area for 30 years in our state, employed them as a partner, and then have been able to grow out a network of private partners to help us grow the number of available foster families. From there, we've worked on the concerns that keep people from fostering or that would drive people away from acting as foster parents. In particularly, families who were interested in fostering teens were often concerned with liability issues. The teen wrecks the car. The teen sneaks out of the house and steals something from a local convenience store. So through policy, we've been able to address those liability issues regarding the behaviors of teens, especially teens that have been in care and sometimes have some antisocial behaviors. We need families willing to accept the risk of that child's antisocial behaviors without a fear of an additional financial burden for their family, which leads to the financial challenges. In our state, we have pumped significant increases into our foster care system, the rate of reimbursement for our foster families, and as well as systematically trying to professionalize the work of child welfare by increasing the salary range for our child welfare workers, those frontline caseworkers, and increasing the salaries of the leadership in the child welfare division so that we can improve the quality of leadership and supervisors so that we have the highest quality frontline worker possible. Along with those things, we've done a couple of other things that I highly recommend, and I tell states if you're going to do one thing that will instantly improve foster care in your state, that's implement a foster care ombudsman. Make it someone's job in the state to listen to the concerns of foster parents, to track trends across your state, to intervene when we have conflicts and priorities between child welfare workers and foster families, and to drill down on the data where we have pockets where the system seems to be floundering. So if there's an area of the state where we aren't seeing a retention of foster parents, why is that? Are there specific caseworkers that need retraining? Do we have a lack of available resources in the mental health and medical arena that's making it harder for parents to foster? That foster care ombudsman's position is unbelievably critical. And then the last thing I'll say is that the prudent parent standard that Jennifer talked about, allowing parents to act as parents, even if they're temporary and they're filling a gap for a child, is unbelievably important. If your state has not adopted a prudent parent standard in statute, it's extremely important that you do so. And the last thing is ensuring that the rights of foster parents and foster kids are delineated in statute so that we know what everyone's role is, and if you want to take a look at a piece of legislation we passed in Oklahoma last session, look at House Bill 2552, and that is a foster kids, so it was written actually by foster care participants that are now young adults, where they made a list of the things they wish that their caseworkers and their foster parents would have known regarding their rights as a kid that's been drawn into the system. But you're never finished, but there is nothing that you'll do that'll make an impact on your state's future more than making sure statute fully meets the needs of the kids in care. So thank you.
No, thank you, Senator, for that insightful information. I hope that everyone on the line learned as much as I did. And right now we're going to move on to our Q&A portion. So if any of you have any questions, please type them into the chat box on the lower left side of your screen, and be sure to indicate which presenter you are asking your question of. Okay.
All right, I have a couple of questions to either of you, Jennifer or Senator Griffin. Here's the first question. Is it customary that all states do an exit interview with departing foster parents?
So Senator Griffin, I'll take the first stab at that. So I think absolutely not. It is not customary at all, and I think that part of the challenge is that we have never, I think child welfare agencies have not seen themselves as having any customers, where sort of an exit interview or a customer satisfaction survey would be typical in most enterprises. And it is very atypical for a system to be taking an effort at asking our caregivers, how did things go? Did you get the information that you needed? Were the expectations clear? Did you receive the mental and physical supports that were necessary? Did we give you everything possible to make sure that you could provide excellent care for this child? And it's even less typical for systems to be asking young people, youth who are exiting homes, about what their experience was in that foster home in an effort to assess quality and measure quality and to address issues on subsequent placement. So I think it's a wonderful policy idea. I know we have 2 QPI sites who have started the process of trying to develop customer satisfaction surveys between foster parents, social workers, and youth. Florida is one of them, and a couple of California counties have taken that on as well. So we'd be happy to provide those examples, but it's definitely not customary yet.
Great, thank you. We had a question about legislation for the foster care ombudsman, and we will get that from Senator Griffin and forward that on to everyone. Also, I put some links in there to other legislation that NCSL is tracking related to this topic, like reasonable and prudent parenting, and one of the bills that Senator Griffin was talking about. And we do have a Child Welfare Ombudsman or Office of the Child Advocates page where we track what states are doing and what their legislation is on our website. I will send that to everyone as well. We have another question. In California, the QPI, the Quality Parenting Initiative, is in policy, but on the ground, support for resource families is not taken seriously. How do individuals hold counties accountable to the policy?
Yeah, so every single one of our Quality Parenting Initiative jurisdictions has a different model to it. In California, it is not a statewide initiative. It's actually a county-based initiative, and not all California counties are participating. I think at last count, 25 California counties were QPI sites. And so I think that what is really important for any policies that have to do, or initiatives that have to do with supporting families, is to ensure that your system has in some sort of an accountability measure where leadership or policymakers are regularly having conversations with a wide and diverse group of foster parents, of young people and youth, and of birth parents. And so those are another angle for, I think, policy reform, is ensuring that, like in California, we have a official vehicle for Youth Voice, the California Youth Connection, that regularly meets with our State Department of Social Services, that is always present in our state legislature weighing in on policy reform. Florida has a similar coalition, Florida Youth Shine. There are a number of states who have those kind of groups. I think it is really important to get written into policy those opportunities for families and for young people to be having that kind of weigh-in and feedback, and also that it is built in consistently for leaders to spend some of their time gathering those results. I think people become accountable to the people that they spend the most time with. And so if we obviously know in the policy arena this is a challenge because our young people are not seen as constituents. They don't vote. They often come from families that are extremely politically disenfranchised. So we can take a policy approach at mandating that there is formal places for young people and families to weigh in.
Thank you. How do we judge which programs are most effective? How can we tell that, or what resource can you point us to?
Senator Griffin, do you want to take a question?
Well, and kind of back on that second one, one of the missing links when it comes to improvements in the system is very frequently judges. And when holding the counties accountable for the prudent parent standing, we may have caseworkers and district attorneys and foster parents and everyone on the same page. If the judge isn't on that page, it doesn't really matter. So we've worked really hard to make sure that our Office of the Courts is involved and has all the up-to-date information as well. As far as judging programs, obviously anything that's evidence-based, you're going to be able to find that evidence. So that's a great place to start. When we began to employ the use of private contractors, that's one of those contract requirements is the use of evidence-based programming and things that are at least listed as promising by organizations that evaluate program implementation. So SAMHSA is a great resource, and NCSL as well.
Yeah, and I just wanted to weigh in on that one too, because I think what is really telling is that for many years the only evidence-based practice in child welfare around being able to improve outcomes, and now the number one rated intervention is one developed by Dr. Mary Dozier at University of Delaware called Attachment Biobehavioral Catch-Up, and the entire intervention is focused on bringing foster parents and relative caregivers to her lab to teach them a way of providing nurturing and attentive caregiving. And they have been tracking outcomes over time for children, and their latest wave of research has been done on the children who experience this in early childhood, this intervention, and they're now latency age, they're early preteen, and they're finding that the impact of that excellent nurturing parenting lasts. So it's actually sustaining as children grow up towards adulthood. So our system has the evidence that, in fact, this really is the most important intervention. Now our policy has to catch up to it, and I think we're moving towards that with the move towards families and away from congregate care. But the earlier participant question about now how do we make sure that those families are supported and that our policies are actually resourcing that support and removing barriers is the big question for for every state to grapple with.
Oh, great. Thank you, Jennifer. Yes, indeed. We had Mary Dozier at the first Child Welfare Fellows meeting, so we did hear a bit about that program, so it's great to hear you, pick up on that. I have another question. This is probably for Senator Griffin. How did you address, liability issues, liability, fears related to foster parents taking on this tremendous task?
There's actually statute that we have written, and I can find that for whoever may want to have access to that just specifies that delinquent behaviors and the destruction of property and the commission of a delinquent behavior by a child in state's custody is the responsibility of the state, as opposed to the foster parents. And it's just a very tangible concern that foster families, that we're going to take on some of our tougher kids, especially kids that are duly adjudicated as deprived and delinquent, which is a special population that can be extremely hard to place. Part of this actually came through our juvenile justice system and a desire for us to get more of our juvenile justice involved children placed with foster families, even some that are not adjudicated deprived. So spell it out. It's just like a typical piece of statute that limits liability. It's a liability limitation statute.
Great, fantastic. Are there any more questions? We have time for probably one more. If not, I'll pass this on to Gerard to wrap us up.
All right. So in that case, we will transition to a few more pieces of information. Remember that an archived copy will be available shortly online. To the Child Welfare Fellows, thank you for joining this webinar today. We look forward to seeing you in Santa Fe in November for our second face-to-face meeting. If you have any remaining questions, feel free to connect with me or my other child welfare colleagues. You can see our contact information on the screen. As a friendly reminder, please keep in mind that NCSL is here for you. We will be very happy to provide you with additional research, resources, or follow-up information that may be helpful to you and the work you do in your state or on foster recruitment and retention. Finally, at the conclusion of this webinar, a brief evaluation survey will pop up on your screen. Your feedback helps us in crafting the most meaningful programming in the future. Please take a few moments and tell us what you thought about today's webinar. We value your feedback. Thank you, and enjoy the rest of your day.